Hello, my name is Kathy Quarles-Moore, and I'm an associate professor at the University of South Carolina College of Pharmacy. I'm also a practicing independent community pharmacist, and today I'm going to be guiding you through some of the top 300 drugs that we use in community pharmacy. The first section we'll be talking about today is going to be the anti-infectives. And as the name suggests, these drugs treat all types of infections, such as bacterial, viral, fungal, and protozoal.
Antibacterials and antiprotozoal drugs. We're going to start with metronidazole, which is the generic name for the oral Flagyl or Flagyl ER, topical version Metrogel or Metro Cream, and the vaginal is Nuvesa or Vandazole. Some common indications, and indications mean, what is it used for? Well, it's used for bacterial vaginosis, trichomoniasis, and other ailments. Some of the side effects would be a metallic taste, darkened urine, or nausea. And if you look, there's some contraindications, but I'm really not going to go over those. I'm just going to keep going over slides to let you know what these are. Some antifungal agents that we know of, they end in the azole, Fluconazole, Ketoconazole, nystatin, and terbinafine. Well, nystatin and terbinafine do not end in OZLE, but they're still antifungal agents, and that's important to note. But a lot of them, if you see the azole on the end, they are an antifungal, and that's a good way to remember those. Let's talk about some of these. Fluconazole is the generic name for the brand name Diflucan, and Diflucan is an oral version that is used for yeast infections. They can be oral yeast infections, esophageal yeast infections, or vaginal yeast infections. And this consists of oral thrush or oral candidiasis. And some of the side effects would be elevated liver functions, that's LFTs, QT prolongation, rash potentially, pruritus, and headache and hair loss. The imidazole antifungal agent is ketoconazole, which is the generic name for Nizoral. And Nizoral comes in an oral dosage form, a cream form, a foam, and a shampoo. And the indication of ketoconazole is a fungal infection. It's an antifungal. Remember, we talked about that 2 slides ago. And some of the side effects are the same as the diflucan or fluconazole. Elevated LFTs, QT prolongation, headache, hair loss, and rash or pruritus. So they're very similar in nature as far as their side effects. Now let's look at one that's still an antifungal, but just a little bit different. It is called nystatin. That's the generic name for micastatin or Nystop. Micastatin is the oral version. It can be in suspension or a tablet, and Nystop is a powder that contains nystatin. And this antifungal agent is really good for a mild localized candida infection. Example of this would be thrush. Terbinafine is another antifungal agent, and the brand name of terbinafine is Lamisil. That is the oral version and also a topical version. And the common indication for terbinafine or Lamisil is dermatophytes. It can be used for nail bed infections if you have a topical formation with a carrier that's it can pull it through the nail bed, or it can be used for jock itch or athlete's foot. And some of the side effects would be, again, elevated LFTs, headache, skin rash, and pruritus. Not as many side effects as the ketoconazole and the fluconazole. Let's go to some antiviral agents. Maybe the Acyclovir or Valacyclovir. And you know what's pretty cool about this? You can tell these are antivirals. Guess why? Because they've got VIR on the end. Acyclovir, Valacyclovir. And if you just kept on going, you could say acyclovirus, Valacyclovirus. But we're stopping at vir. Let's talk about these. So Acyclovir comes in the branded name Zovirax or Zovirax. It's an oral capsule. It comes in a tablet, a suspension. It's also in an injection and a topical formation. And some indications of this, the herpes simplex virus, which is like a cold sore, varicella zoster virus, like chickenpox, herpes zoster, shingles. It's very good to treat shingles if you catch it early. Herpes simplex labialis, which is also cold sores. So this is a good agent for that. Some of the side effects would be elevated LFTs, headache, skin rash, and pruritus. Valacyclovir goes by the brand name Valtrex, and this is also indicated for the herpes simplex virus, varicella zoster virus, or herpes zoster, or herpes simplex labialis. So we just talked about that same thing. This is a little bit newer drug than the Acyclovir. It came out a little bit later, but it still has the same indications, and it also has similar side effects: elevated LFTs, headache, skin rash, and pruritus. So now let's talk about something called cephalosporin antibiotics. And you have the first generation Cephalexin, the second generation Cefuroxime, and the third generation Cefdinir, just to name a few. So let's talk about the first generation cephalosporin antibiotics. Cephalexin's PO version, a PO name, the by-mouth, PO is by mouth. The oral version is known as Keflex, and it's used for skin infections, strep throat, and it has some side effects. Really, most of the side effects would be considered GI side effects like stomach upset, diarrhea, and maybe some skin reactions. And there's also a possibility of a cross-sensitivity with somebody that has a penicillin allergy. This is really good to know. I think it's like 10% of the population that has a penicillin allergy can also have a cross-sensitivity to cephalosporin. So that's very important to remember, to tell your patients. The second generation cephalosporin that we're going to talk about is Cefuroxime, axetil. Axetil is a salt. The by-mouth of the oral version brand name is called Cefdin. And you can think about this. Cefdin CEF is considered second generation, where CEPH, if you look back to the other one, is first generation. So we're going from the PH to the F. Does that make sense? Okay, and some of the indications of the cefuroxime would be acute otitis media and maybe community-acquired pneumonia. And there again, we have the same side effects that we did with our first generation cephalosporin: GI upset or stomach upset, diarrhea, and serious skin reactions. And we still have that cross-sensitivity with penicillin potentially. The third generation cephalosporin antibiotic, the oral version is named Omnicef, CEF, and you see Cefdinir, get it? Cef. And it's used for otitis media, and it also has some of the similar side effects as the other two, first generation and second generation. It can cause stomach upset, diarrhea, serious skin reaction, and there again, it has a cross-sensitivity with penicillin allergies. Moving right along, we're going into our fluoroquinolone antibiotics. We're going to look at Ciprofloxacin, Levofloxacin, and Moxifloxacin, just to name a few. Notice they all have the last part of their names, floxacin. Fluoroquinolone, floxacin. You making that connection? Good. Ciprofloxacin's brand name is Cipro. It is used a lot for pneumonia, but it also has some side effects. QT prolongation, hypo or hyperglycemia, that's where your blood sugar is affected, psychiatric disturbances, and photosensitivity. They have something that's called a black box warning. This is very important to talk to your patients about. Tendon inflammation and or rupture, which can occur in younger folks, but a lot of times it occurs in older people. You want to make certain that you tell your patients this is a possibility, especially if they're athletic, they run a 5K and they're on ciprofloxacin. You might want to warn them about that. Peripheral neuropathy is a black box warning. Also, you have to use it with caution in patients with CNS disorders or those that are taking seizure-causing medications, because this one may cause some seizures. Levofloxacin's brand name is Levaquin, and its common indications for respiratory infections, very similar to the ciprofloxacin. And it has, if you notice, the side effects are very much the same. QT prolongation, hypo or hyperglycemia, psychiatric disturbances, photosensitivity, and it has the same black box warnings. So be aware. Moxifloxacin, the brand name Avelox, is also used for respiratory indications, is indicating respiratory diseases, and it is an anti-pseudomonal, which is pneumonia, and it has the same side effects as the other two: QT prolongation, hypo or hyperglycemia, psychiatric disturbances, photosensitivity, and look at those black box warnings, very important. This one cannot be used for urinary tract infection, PS. Now let's move into our macrolides, Azithromycin and Clarithromycin. Notice they have the similar last part, omycin, mycins, okay? Macrolides, mycin, macrolides, M&M. Azithromycin's brand name is Zithromax or Z-Pak. The common indication is community-acquired respiratory infections and COPD exacerbations. Also, chlamydia. The drug of choice in pregnancy is Zithromax, and severe traveler's diarrhea. Some of the side effects of Zithromax would be GI upset and taste perversion. It can give you a little bit of a weird taste in your mouth. And it's important to tell your patients these things, because if they come in and they say, I'm not tasting right, they may think something else, something's wrong. And you just need to tell them before they take the medication that they may have a little bit of taste perversion. So a warning of this drug is, I just want to share this because it's important, QT prolongation and hepatotoxicity. Very important. The Clarithromycin, brand name Biaxin, has an indication for H. pylori treatment regimens. It's used in combination with other drugs a lot of times to treat H. pylori. And its side effects would be, again, GI upset and taste perversion. Important to tell your patients. And look over there. We have warnings of QT prolongation, hepatotoxicity, and also we're told to use with caution in patients with coronary artery disease. So let's look at another antibiotic, lincosamide antibiotic, Clindamycin. Clindamycin is actually used for skin infections. It's a beta-lactam alternative for dental abscesses, surgical prophylaxis, and infective endocarditis prophylaxis. The oral dosage form is called Cleocin, and there's a topical called Cleocin T, and also comes in an injection form. Side effects of the clindamycin would be really stomach or GI side effects, nausea, vomiting, and diarrhea. And this one actually gives you an increased risk of Clostridium difficile infections, C. diff. So you need to let your patients know about that. Nitrofurantoin antibiotics, Nitrofurantoin, Macrobid, Macrodantin are the brand names, and it's actually a drug of choice for uncomplicated urinary tract infections. Some of the side effects would be stomach upset. This one you need to take with food. Sometimes this drug will cause a little bit of brown urine discoloration. People sometimes get a little freaked out with this because they think that brown urine might be a little blood. It looks a little funny, and so they're just absolutely freaked out. So you need to let your patients know this. Make sure they know that it could cause brown urine discoloration. Now we're going to another grouping of antibiotics, the penicillin antibiotics, Amoxicillin, Amoxicillin Clavulanate, Penicillin V Potassium. And we're going to start with the Amoxicillin. Notice when we talk about penicillins, is Cillin, Cillin. Well, Amoxicillin is a synthetic penicillin, and its oral form is Amoxil, and it comes in a tablet, a capsule, a chewable, and a suspension, and it's a first line for acute otitis media, and it's also a prophylaxis for infective endocarditis prior to dental procedures. Some of the side effects are seizures when it's not renally adjusted. Got to be careful with that. Stomach upset, diarrhea, rash, and hemolytic anemia. So these are side effects we need to talk to our patients about. And if you have something that causes a stomach upset, in the Cillins, the Amoxicillins, the penicillins, it's not going to really hurt to have patients take this with a little bit of food. It's going to slow down the absorption just a little bit, but they're still going to get the dose. So just remember that. Penicillin, Amoxicillin. Amoxicillin Clavulanate. Well, what they've done with this drug is Amoxicillin, and they've added something to it. Clavulanate, which is a good thing. It's important because it's also first line for otitis media and bacterial sinusitis. The brand name of Amoxicillin Clavulanate is Augmentin, and it comes in a tablet, capsule, chewable, and a suspension. And here again, we have seizures when not renally adjusted, stomach upset, diarrhea, rash, and hemolytic anemia. Clavulanate can actually precipitate more diarrhea than the plain amoxicillin, so we're trying to use the lowest dose of clavulanate in order to decrease that diarrhea, which can be very annoying. Let's move on to Penicillin V Potassium. The brand name is PenVK, and the common indication is the first-line treatment for strep throat and non-purulent skin infections. Some of the side effects, same as the other penicillins: seizures when not renally adjusted, stomach upset, diarrhea, rash, and hemolytic anemia. Moving along to another class, sulfonamide antibiotics, SULF, S-U-L-F. Well, the first one I'm going to talk about is sulfamethoxazole trimethoprim. And if you notice the sulf and the sulf, that gives you a big hint. It's a sulfonamide antibiotic. The oral dosage for this, the brand name is Septra, Septra DS, Bactrim, Bactrim DS. It comes in a tablet form, a capsule form, a chewable, and a suspension. Some of the common indications for this are urinary tract infections, MRSA skin infections, that's methicillin-resistant staph aureus, pneumocystis pneumonia, and some of the side effects of the sulfonamide antibiotics would be photosensitivity, crystalluria, hemolytic anemia, and elevated potassium levels. Since this does cause or can cause crystalluria, one of the most important things you can tell a patient is to make certain that they drink plenty of water. Not just take it with water, but drink plenty of water throughout the day. Also, it's important to note whether they have a sulfa allergy. Not a sulfur allergy, but a sulfa allergy, and also it is contraindicated in pregnancy. Next, let's look at our tetracycline antibiotics: Doxycycline, Minocycline. Tetracycline has a cycline on the end. So does doxycycline, and so does minocycline. Cycling, cycling, cycling. Not cycling, 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 but cycling, cycling, cycling. So minocycline's brand name is Minocycline. It's used for methicillin-resistant staph aureus skin infections and acne. You have side effects of this one would be nausea, vomiting, diarrhea, and it can cause photosensitivity. There is a contraindication in children less than 8 years old. It's contraindicated in pregnancy and breastfeeding, and also in drug-induced lupus. So the important thing with these antibiotics is to separate them from antacids and polyvalent cations. The next one we're going to talk about is doxycycline, the generic name for the brand name Dorix, Oracea, and Vibromycin. Common indications that these are used for is first line for Lyme disease and Rocky Mountain spotted fever, COPD exacerbations, bacterial sinusitis, chlamydia, acne, MRSA skin infections, and the list goes on. There's a lot of things this is used for. One thing about this particular antibiotic, it can cause nausea, photosensitivity, diarrhea, and vomiting. After you take this drug, you need to sit upright for at least 30 minutes after a dose and take it with a full glass of water. And here again, you have to separate it from antacids and polyvalent cations. So let's look at some topical antibiotics. One of them is Mupirocin, the generic name for the brand name, which is the topical Bactroban. And this is indicated for the elimination of MRSA colonization of the nasal passage. Some of the side effects would be headache, burning, localized irritation, rhinitis, and pharyngitis. The next class of drugs are antivirals against influenza. Oseltamivir. You see the vir right there? Antiviral. So the brand name for oseltamivir is Tamiflu. It comes in a capsule and suspension. And the common indication is the flu. Some of the side effects would be headache, nausea, vomiting, diarrhea, and abdominal pain. This drug is most effective when it's started within 48 hours of the symptom onset. So I would tell my patient too, I generally tell them to eat some food with this one because this one does come back a lot of times. Patients complain of the stomach upset. Very important. Hydroxychloroquine, the generic name for Plaquenil. This is the aminoquinolone disease-modifying anti-rheumatic agent. Some common indications of this drug are rheumatoid arthritis and lupus. Now, some of the side effects would be nausea, vomiting, and diarrhea, abdominal pain, rash, pruritus, headache, vision changes, and more vision changes. So one important thing with this drug, the Plaquenil, you need to sit upright for at least 30 minutes after you dose it and take it with a full glass of water. Very similar to doxycycline. Hydroxychloroquine, Plaquenil. Next, let's look at an antibacterial oral rinse. Chlorhexidine Gluconate. The brand name is Paradex or Periogard. The common indication is for gingivitis, peritonitis, and this is what the dentist gives you a lot of times after you have some sort of oral surgery. Sometimes when he feels like you've got some gingivitis in the mouth, he'll go ahead and give it to you. Some of these side effects would be dental discoloration. It can discolor your teeth after long-term use. Short-term use, not so much, but long-term use, yes. Mouth irritation, dysgeusia, which is a taste perversion. It does taste weird. After you use it, it's hard to taste food. So you might want to tell your patient to wait a little bit before they eat something. And some diarrhea. This one is generally swished and spit twice a day. Okay, let's look at the antiretrovirals. Emcitritabine plus Tenofovir, Disoproxil, Fumarate. So this is a long name, and I said it very slowly to try to get the pronunciation out there, and I may have butchered that, but we tried it. So the oral version of this drug is Truvada, and one of the common indications is HIV. It's got some black box warnings in it. Post-treatment exacerbation of acute hepatitis B and the risk of drug resistance with use for pre-exposure prophylaxis. And it can also decrease bone mineral density. Some of the side effects: hyperpigmentation of the skin, nausea, vomiting, and diarrhea, and lactic acidosis.